I'm David Klein. I'm an orthopedic surgeon in Sarasota. In this orthopedic moment, I wanted to discuss what is a fracture. People ask me the question, hey doc, is it broken or is it fractured? Well, from an orthopedic standpoint of view, a fracture is an injury of a bone where the bone has a crack in it, or the pieces of the bone may actually be out of position. They may be displaced, they may be translated, or they may have a gap between them. Sometimes there's just the crack that you can see on an x-ray or even can't see on the x-ray, almost like a crack in a drinking cup where you can still drink tea out of it without dripping any fluid out of the glass. So is a fracture the same thing as a broken bone? It is from an orthopedic standpoint. Usually we'll use separate terms to describe what's wrong with it in addition to the fact that the bone is broken. We may say that it is a non-displaced fracture. A non-displaced fracture is where there's a crack between the pieces, but the pieces are still well lined up in both planes. We may say it is an angulated fracture, where the bones are out of position by some angulation from what they're normally supposed to be lined up as. We may say that it is a gapped fracture or a displaced fracture, which describes the pieces. We may use other terms that talk about how many pieces, like a two-part fracture or a three-part fracture, or describe it as comminuted with lots of many small pieces. Also, we sometimes describe fractures as open fractures. An open fracture is a fracture where the skin is torn and there's bleeding from the compartment of the forearm or leg or other body part where the fracture is located. This is important because these have higher risks for infection. So in general, a fracture is a break, but it all depends on how you describe it.